Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about how to prevent painful breastfeeding. Breastfeeding can be uncomfortable for new mothers, but continued feeding should not be painful. Nursing is meant to be a special and pleasant experience for you and your baby. Watch till the end and know better as I teach about learning the proper techniques, developing good feeding habits, and how to avoid medical causes of painful breastfeeding. All these will help keep your baby well fed and you happy and comfortable during this special time. How to prepare for successful breastfeeding. Educate yourself while you are pregnant. Talk about your breastfeeding plans with your doctor or midwife before you give birth. Consult with your lactation specialist before leaving the hospital. Get a tutorial on breastfeeding from this lactation professional. Often they will sit with you for your first few feeding sessions to offer feedback and advice on proper and comfortable methods. This is an invaluable tool for new mothers. And if you don't have access to lactation specialist, this is a perfect video to watch till the end. Position yourself correctly. Sit comfortably and support your back with pillows or a cushion. Do not lean forward or bend over your baby. Instead, hold your infant close to your body with their body facing yours and their head at the same level as your breast. With one hand, support your baby's head. With the other hand, support and offer your breast by forming a C shape with your hand around, but not covering, the areola, the darker area around the nipple. You can put a pillow under your arm that is supporting the baby. Ensure proper latching. Poor latching is a common cause of breastfeeding pain. When in your correct position, gently touch your nipple to your baby's bottom lip to encourage them to open wide. You can also gently lower their chin to prompt them to open their mouth. Allow them to take your whole nipple and much of the areola in their mouth. When your baby is latched properly, you shouldn't get a pinching feeling on your nipple. Rather, you should experience a slight pulling feeling on your breast. Developing healthy nursing habits. Nurse your baby on a regular schedule. Infants eat fairly regularly, usually about every 2 to 3 hours. Nurse on a consistent schedule. If you wait too long to feed, your baby may be more likely to bite down on your nipple. Keep in mind that babies tend to bite when they are really hungry, so pay attention to your baby's signals to avoid letting them become too hungry. Every baby is different, so keep an eye out for your infant's feeding patterns. Watch for signs that your baby is getting hungry, like moving their mouth, making suction motions, crying, or becoming restless. This might indicate you should feed more frequently. Discourage biting. It's not uncommon for your baby to bite down on your nipple when they develop teeth. You should gently discourage this and train your baby not to bite. Watch my previous video on how to stop baby biting while breastfeeding. Everything you need to know about biting and more is on that video. Alternate your breasts for feedings. Allow your baby to fully drain the milk from one breast before moving to the other breast. This usually takes 15 to 20 minutes, but every baby is different. Your breast will feel softer once it is empty. Then offer the other breast, or begin with the other breast for the next feeding. Start feeding on the least sore breast first, unless the cause is mastitis or engorgement. Express milk regularly to prevent engorgement. If you are between feedings and your breasts are feeling overly full and tender, express a little milk by rubbing or massaging them gently. Use a breast pump to relieve pressure and save milk for your baby if you work full-time or are otherwise away from your baby during the day. Try to pump every few hours. Wear supportive, but not overly tight, bras and clothing. Putting unnecessary pressure on your breast with a tight bra or blouse might affect how milk can flow through the ducts. This can lead to mastitis or a blocked duct, two causes of painful breastfeeding. You want bras to support full breasts without squeezing or constricting them. Keep clothes and pumping gear clean with thorough washings. Keep your breasts free from bacteria or yeast that cause infections. Nipples can develop yeast infections, causing sharp or burning pain that lasts throughout a whole feeding. Keep bras, pumping equipment, and nursing pads clean by washing them frequently. Wash your hands before and after you breastfeed. Do not use shampoo or harsh soap on your nipples. Avoid using bath products that can irritate your skin. Gentle cleaning with warm water should be sufficient. Delay giving your baby a pacifier. Wait to give your baby a pacifier until their feeding habits are well developed, usually after 3 to 4 weeks. Sucking on a pacifier can teach them poor habits, since a pacifier differs from a nipple. Once they have the hang of feeding, it's okay to introduce a pacifier. Stay hydrated. Drink at least 8 to 10 glasses of water every day. Staying hydrated can help to prevent painful causes of breastfeeding like a blocked duct. Wean your baby from breastfeeding gradually. If you abruptly stop breastfeeding, you will likely experience painful engorgement. Make it a slow process by gradually decreasing how frequently and for how long you nurse every day. Do this over a few weeks, or even months. Use a cold compress on your breast if you do have uncomfortable swelling during this time. Dealing with medical causes of painful feedings. Heal chapped or cracked nipples with lanolin or olive oil. Nipple irritation, soreness, drying, and cracking is common with breastfeeding mothers. Use purified lanolin or pure olive oil on cracked nipples after you feed your baby. You can also dab some of your own breast milk onto sore nipples, which can be soothing. Gently pat wet nipples dry. Rubbing them can cause further irritation. You can also dry them with a hair dryer on the cool setting. Use a heating pad on a blocked milk duct. Blocked ducts usually cause a firm, swollen mass in the breast tissue and cause the skin over it to redden slightly. Blocks usually resolve on their own in a day or two, but do what you can to resolve them quickly to minimize discomfort. Use a heating pad or hot water bottle on the area to soothe it. Try to unblock the duct by continuing to feed from that breast, get a good latch, and gently squeeze around the duct with your hand as your baby suckles. You can also massage the lump towards the nipple. This may help the breast drain better. Treat mastitis. Mastitis is an infection in the breast that usually occurs due to bacteria getting in through a cracked nipple. You will have a warm, swollen, painful lump in the breast, and probably a fever of 101 degrees Fahrenheit, 38.3 degrees Celsius, or higher. If you suspect that you may have mastitis, then call your doctor right away for antibiotic treatment. You do not have to stop breastfeeding when you have mastitis. In fact, continue to feed from the affected side. This can help to clear the infection, and causes no harm to your baby. A blocked duct can lead to mastitis. Make mastitis more comfortable by placing hot compresses or water bottles over the tender area. Check for tongue tie. Tongue tie, or ankyloglossia, occurs when the thin tissue connecting your baby's tongue to the bottom of their mouth is unusually short. This makes it more difficult for them to move their tongue, and can increase the pain of breastfeeding. Check whether your baby's tongue is shaped like a heart at the tip, or ask your doctor to check at your next visit. Tongue tie is easily fixed with a simple procedure. How do I stop the pain from breastfeeding? When you're breastfeeding, go ahead and lean back so that you're really comfortable. Not only will you be more comfortable, but gravity will also help your milk flow. Most people are taught to sit straight up when they're first learning to breastfeed, but that can make it really hard to hold the baby up properly and make sure their body is positioned well. Be sure to consult your doctor or a lactation consultant if pain is severe and does not go away. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.